Hey, good afternoon, everybody. It's noon, so I will get the presentation started. First off, welcome to the ARTA and the ARTA Benefits Plan webinar. My name is Jennifer Hope, and I am the Manager of Marketing and Promotions here at ARTA. And today I'm going to talk to you a little bit about ARTA, give you a brief history, talk about our membership advantages, and of course, dive right into our benefit plans that we offer to our members. So just a little bit about ARTA. ARTA was founded in 1963 as a provincial association for retired teachers by retired teachers. We have also expanded our groups to similar groups that hold the same type of insurance risk as a retired teacher would. So as Norquest College employees, you are eligible to join our education sector as an affiliate member. We have been the sponsor of the Group Benefits Plan since 1995. We also self-administer our benefits plan, so everything is done under one roof here at ARTA. We have over 30,000 members and we cover over 41,000 lives. So that 41,000 lives are our primary card holders' dependents, so dependent children or spouses. Our provincial office is located in Edmonton. So if you are in Edmonton, you can come visit us and you can schedule a meeting with one of our member services team members and meet with them in person. So you can sit down and talk about all of our benefits plans and which plan might work best for you and your family. Or if you don't want to come into the office, you can visit arta.net and meet with one of our member services team members virtually. You don't have to meet with somebody. If you know the plan you want, you can apply online and do it all yourself. Just letting you know that there are resources out there for you. So there is a fee to becoming an ARTA member, and for affiliate education sector members, it is $50 a year. And if you do get benefits, that is $4.17 added onto your monthly premiums. So when you do become an ARTA member, not only are you gaining access to join one of our health benefit plans, we also have some really great membership advantages. We have wellness initiatives that we host throughout the year. We have a photo contest. We have a physical wellness initiative as well as a writing contest. So these are sort of some ways how we ensure that our members are living engaged and healthy lifestyle. We also have a really good member discount program. So we have partnered with different businesses that offer discounts to our members, such as Brewhouse, Softmock, Mark's Work Warehouse, Broadway Across Canada, Magic Bus. We recently brought our member discount program in-house because we feel that we can serve our, sorry about that. We can serve our members better by reaching out to businesses that are local or are offering good enough discounts for our members. So using your member discount program, ARTA Perks card once or twice, pays for your membership all on its own. We have a really great scholarship program. So we award 8 scholarships annually that total $40,000. So we provide $5,000 scholarships to 8 recipients in post-secondary education, whether that is a degree, a diploma, or a trade. They just need to be in at least their second year of post-secondary education. This is kind of ARTA's way of supporting our members, children, so grandchildren, nieces, nephews, any direct relatives in post-secondary education. We also advocate on behalf of our members, so we always ensure that our members' voices are being heard on different issues that affect seniors and educators. So just know when you join ARTA, you are joining a group that will advocate on behalf of you. So now I'm going to dive right into our benefit plan. So just a bit of a background of the ARTA Benefits Plan. The group plan was established in 1995 by a group of retired teachers who wanted to create a benefits plan that was more conducive to a retiree's lifestyle. You're no longer bounded by your vacation time or when school is in and school is out. You can travel, anytime or for however long as you want. So the ARTA Benefit Plan has some really great emergency travel coverage. Our emergency travel coverage is very unique and competitive because we don't have any stability clauses for pre-existing conditions built into our plans. A lot of plans require that you're stable for 90 to, I've even seen 300, up to 365 days. So just know that when you are joining an ARTA benefits plan, your emergency travel coverage is definitely some of the best there is in the marketplace. ARTA is a not-for-profit organization, so any dollar that comes into ARTA goes back to administrating the plan, back to paying out any claims, and ensuring that we're offering our members the best benefits plan that we possibly can. There are plans that will offer you a discount when you join. We don't have those discounts available because we don't have those profit margins built into our benefits plans. Also, I forgot to mention at the beginning, if you have any questions throughout this presentation, please use the Q&A function in Zoom, and I will answer them as they come in, or I'll have time at the end to answer any questions that you might have. So there are some eligibility requirements that you need to meet before joining ARTA. If you are, part of a government sponsored pension plan or matching RSPs, you can join ARTA under our affiliate education sector membership. You need to be an ARTA member, so you have to pay that $50 a year that I spoke about. You need to be a Canadian resident covered by your provincial or territorial health insurance plan within your province of residence or territory. We have members located throughout the country. If you decide to retire in Alberta and you join ARTA, but you want to move to BC and enjoy their warmer climate, you can. The only province where ARTA benefit plans is not eligible is in Quebec, as their provincial healthcare plan does not work in tandem with the ARTA benefit plan. There's no age restriction to joining ARTA. You can be 40 or you can be 80. You can join at any age. We also don't have any termination ages within our plan. So when you are comparing different plans, make sure you are looking at those termination ages to see if your plan will terminate you at a certain age. Your eligible dependents can join ARTA, as well as your surviving spouse. So if you're eligible to join ARTA today and something were to happen to you, your surviving spouse can join ARTA. Or if you join as a primary cardholder in ARTA and something were to happen to you, your surviving spouse can continue on with their benefits. We do not terminate any surviving spouses. So applying to ARTA is easy. I typically suggest to people, if you know you want to join ARTA and you are going to be losing your employer-sponsored health benefits, get your application in like 4 to 6 weeks before you lose those benefits. So if you are retiring and you are going to lose those benefit plans and you want to join ARTA, get your application in early. It's just something easy to do that you can check off the list. However, it is really important to submit your application within 60 days of losing your employer-sponsored benefits. Because if you do apply outside of that 60-day window, you would need to fill out a medical questionnaire that is administered by our emergency travel coverage partner, Beneva. However, you can apply at any time for any of the plans that do not include emergency travel coverage. Or perhaps you decide to retire and your spouse is continuing to work. You can join their benefits plan. That's great. Have their employer help pay for your health benefits. But once your spouse loses those benefits, make sure you apply within that 60-day window. And your ARTA benefits are available on the first day that your employer-sponsored benefits terminate. So there's no waiting period. We don't want our members to have any lapse in coverage. I have a question here. What about pre-existing conditions? If you apply to ARTA within 60 days of losing your employer-sponsored benefits, you don't have to fill out a medical questionnaire. There's no questions asked about your health. But if you apply outside of that 60-day window, you'd have to fill out that medical questionnaire. So now I'm going to talk about the different plan options that are available for our members. We sort of have two umbrellas of plan options. We have our comprehensive plans and our build your own plans. Our comprehensive plans were built for members under the age of 65 who aren't able to join the Alberta Coverage for Seniors plan yet. So these plans offer some higher prescription drug maximums, emergency travel coverage, extended health care, as well as dental care. And our build your own plans were built to work directly in tandem with the Alberta Coverage for Seniors plan. When you turn 65, you can join that plan, and they're the first payer in prescription drugs, and ARTA becomes the second payer in prescription drugs for drugs that are listed on the Alberta Drug Benefit list. I'll talk about that a little bit later. So now I'm going to talk about our comprehensive plans. So our comprehensive plans are available for members who are under the age of 65. We have three different options: core health, essential health, and enhanced health. Core being the most basic of the three, and enhanced health having those higher maximums. All of our plans include single, couple, and family care coverage, and you're always able to move up in coverage. But once you've moved up in coverage, you are locked in for 24 months for all of our plans. Within our comprehensive plans, you are covered for 100% overall coverage level, unless otherwise indicated. And the overall annual maximum ranges from $10,000 all the way up to $15,000. Prescription drugs are covered at 80% under our comprehensive plans, ranging from $1,500 a year all the way up to $5,000 a year. A lot of people don't know how much money they've been spending on prescription drugs throughout, the past couple of years because your employer has been helping pay for it. I typically suggest maybe go to your pharmacist, say, hey, can I get an annual average of the past 2 years of how much I've been spending on prescription drugs? And then you can make an educated guess on, which plan might work best for you and your family. And again, you are always able to move up in coverage, but once you've moved up, you are locked in for 24 months. Our comprehensive plans also include 80% coverage for paramedical services. And our paramedical services annual maximum is our paramedical practitioner maximum is a little bit different than other plans. It's an annual combined maximum. So for example, if you had essential health, you have $1,000 to spread out through the year on those practitioners. So we have done a little bit of research, and most people only use 1.8 of those practitioners. So massage, chiro, physio, occupational therapy. We cover a list of 12 different practitioners, but maybe you're someone who only wants massage. You can spend that $1,000 a year on massage. When you are looking at different plans, some of them offer, $500 for massage, $500 for counseling, $500 for physio, $500 for acupuncture. You might not use all of those different practitioners throughout the year. So ours is an annual combined maximum. We want our members to be able to use the practitioners when they want it. Diabetic supplies are a little bit different under our comprehensive plans. We offer $1,750 a year for diabetic supplies, and that is a separate line item from your prescription drugs. So there's some additional benefit. Our plans also include, the comprehensive plans also include our 92-day emergency travel coverage, and you're eligible for supplemental travel coverage. Question, is the coverage per person or per family? All of our annual maximums are per covered person. So each covered person receives the maximum. So you each, for example, under essential health, have $1,000 to spend on paramedical practitioners. So our comprehensive plans also include some dental care coverage. All of our plans include 80% coverage for any basic, preventative, or minor restorative work. And our enhanced health plan also offers 50% coverage for any major restorative work. So your crowns, your implants, your implants, all of that nasty dental stuff that some of us do need. We also offer 50% coverage for orthodontic work up to a $2,000 lifetime maximum for any eligible dependents that may need some more orthodontic work. Maybe perhaps you have some family members that still need braces or spacers or all of that expensive dental stuff. So now I'm going to talk about our build your own plans. So our build your own plans were built to they were built to work directly in tandem with the Alberta Coverage for Seniors plan. So when you turn 65 years old, the Alberta Coverage for Seniors plan will pay for 70% of prescription drugs listed on the Alberta Drug Benefit list. And if you have an ARTA Benefits plan, those drugs would be covered at 100%. ARTA also covers a long, robust list of prescription drugs that are not listed on the Alberta Drug Benefit list at 80%. So within our build your own plans, you are required to choose an annual prescription drug maximum of either $1,200 or $2,000. And again, with that might seem a little bit low at first glance, but when you are 65, the Alberta Coverage for Seniors plan is the first payer, and then we're the second payer. So that annual prescription drug maximum does stretch a really long way. So our build your own plans allow our members to have some customization on what they want in a benefits plan. We offer 2 plans that do not include emergency travel coverage, HealthWise and HealthWise Plus, and 2 plans that do include our 92-day emergency travel coverage, Total Health and Ultimate Health. HealthWise Plus and Ultimate Health have some enhancements from HealthWise and Total Health. There are some higher annual maximums for hearing aids, vision care, paramedical practitioner. Also, our Ultimate Health and HealthWise plans offer some coverage for defined lifestyle medications such as hair loss, erectile dysfunction, and weight loss medications. All of our plans, comprehensive and build your own plans, offer coverage for a long list of different medical aids and supplies. This presentation would be very long if I included all of the items that we covered. So also with build your own plans, diabetic supplies, prescription drugs, that is an annual combined paramedical practitioner maximum. So that annual combined maximum for physio, chiro, all of those different practitioners. All of our benefit plans also include these additional resources. So we've partnered with a company called Maple that offers virtual physician services. We all know how hard it can be to get into your doctor. So Maple offers virtual physician services where you can pick up the phone and meet with a physician virtually. And they can help you, maybe prescribe you something that you might need, or let you know maybe if you have to go to the hospital or the Medi Center or whatever it is. So this is a really great service that we do offer our members. We've also partnered with Inkblot, and Inkblot offers our members 5 hours of free couples counseling, as well as 5 hours of free individual counseling. The past couple of years have been really hard on us mentally, so Inkblot is a resource for our members to help with their mental health. ARTA Cares is a program that is powered by Humanicare. And ARTA Cares helps our members navigate the healthcare system. We all know how difficult it can be to, figure out where to go for a medical second opinion, or what you need to do with surgery afterwards, or perhaps you have an ailing parent that might need figuring out how to get into assisted living facility. So these ARTA Cares can help our members navigate the healthcare system, and all of your questions are answered by a registered nurse. So emergency travel coverage. I do see there is a question about emergency travel coverage. I'll go through this slide, and if you still have that question, I will answer it. So if you are taking part in one of our comprehensive plans, or Total Health or Ultimate Health, you are getting access to some of the best emergency travel coverage there is in the marketplace. And I say that because we do not have any stability clauses for pre-existing conditions built into our benefits plans. All emergency travel coverage cases, so any eligible expenses just need to be considered sudden and unforeseen. So for example, if you have a change in your medication prior to your trip, maybe your doctor increased your dosage or decreased your dosage, and you go travel and something were to happen because of that change in medication and there was no cause for concern, you would be covered with that under ARTA. However, a lot of plans require that you're stable for 90 to I've even seen 365 days. Any medical emergency, so just needs to be considered sudden and unforeseen. So you just need to ask yourself, what would a prudent person do if I'm sick? If my doctor said, do not travel, you are too ill to travel, don't travel. And know that ARTA offers $10,000 per insured person per incident, trip cancellation and interruption insurance. We want our members to travel when they're healthy. And even if you have a pre-existing condition, you can go and travel, and just know that you have ARTA emergency travel coverage to keep you safe. So you are covered for 100% of eligible expenses that occur outside of your province of residence, up to a $5 million lifetime maximum. Nobody's ever come close to that $5 million lifetime maximum. So you can rest assured that you are covered for your expenses when you are outside your province of residence. One of the biggest claims that came in was just over $800,000, and that person was covered. So again, that $5 million lifetime maximum hasn't come close to even being reached with any of our members. So you are covered for any 92 days you take outside of your province of residence. We know that a lot of our members like to snowbird in places like Palm Springs or Phoenix, and they take really great holidays to, African safaris, and perhaps their trip is going to be longer than 92 days. We offer supplemental travel coverage in 15-day units up to 212 days. But supplemental travel coverage is an additional cost. So we have some members who hop on a flight back to their province of residence, hold on to proof that they did cross back into their province of residence, and hop back on a flight back into the sunshine even that same day. And at that 92 days is an immediate reset. You are not required to be in your province of residence for a certain period of time. Again, we have no termination age in our emergency travel coverage. A lot of plans will terminate emergency travel coverage at the age of 85. So the question that I did come in about emergency travel coverage is, does emergency travel mean being able to access healthcare while you are traveling? Yes. If you do need to access healthcare while you are outside of your province of residence, and you have a medical emergency, you are able to access healthcare. So our build your own plans do not include dental care. So we offer 3 standalone different dental care options, option A, B, and C. Option A being the most comprehensive and option C being the most basic. Again, with these dental care plans, you don't have to add them as soon as you retire or as soon as you join an ARTA Benefits plan. You can add it later on down the road. It's entirely up to you. Our dental care options do include single, couple, and family care. And again, with our dental care, you are able to move up in coverage, but once you've moved up in coverage, you are locked in for 24 months. So option A, B, and C include 80% coverage for any basic, preventative, and minor restorative work. And option C includes 65% coverage for any major restorative work. And option A offers 50% coverage for any major restorative work. So we also have a really great website, artabenefits.net. We know how confusing it can be to join a benefits plan and choose a benefits plan. So if you visit artabenefits.net, you can click on Build Your Benefits Plan, and that tool will ask you a series of questions of, are you over 65, under 65? Do you want travel? Do you want dental? And from those questions that you answered, a chart will populate with all of the plans available to you, as well as the monthly premiums. Also on artabenefits.net, if you scroll to the footer of the page and click on benefits booklets, you can find all of our benefits booklets, which explain every single benefit that you are covered for, as well as the rate sheet. So as an affiliate education sector member and from Norquest College, you can click on our education sector rate sheet, and those are the rates associated with our benefit plans. ARTAbenefits.net has a lot of different information that you can get. So this website is a really great tool. So that's kind of all I had for today. If you would like us to send you an enrollment kit includes our plan options brochure, as well as a rate sheet. We also include some really great booklets on retirement and membership advantages within ARTA. So if you would like us to send you an enrollment kit, please email join@arta.net and we will get one out to you today. Also, if you have any questions, I'm happy to answer them in the Q&A box. But you are also able to email info or join@arta.net and we will answer any questions that you might have.